Hi everyone, my name is Samantha Smith, and my project is, does bathing technique influence your risk of developing a hospital-acquired infection? The purpose of this integrative review is to examine the effects of chlorhexidine bathing in comparison to soap and water bathing on hospital-acquired infections in the acute care setting. Hospital-acquired infections, HAI, have a high correlation between increased morbidity and mortality. Swan et al. 2016 found that 1,700,000 hospital-acquired infections occur in the United States with an annual cost deficit of $147 billion each year. Studies have shown the successful impact of chlorhexidine gluconate on the elimination of common HAI-causing pathogens. Specifically in the ICU, patients are at a higher risk of developing an infection, and with evolving healthcare practices, the involvement of chlorhexidine bathing should be investigated. Palato's 2019 study found that daily bathing with 4% CHG with alternating water rinses significantly decreased HAI occurrences in the ICU. It is important that we evaluate bathing materials in acute care settings to help eliminate potential infection occurrences and unnecessary costs related to HAIs. The aim of this integrative review is to discuss and analyze the research related to the P-code question as stated above. For patients in the acute care setting, what is the effect of chlorhexidine bathing compared to soap and water bathing on hospital-acquired infections? For my values of practice, in conclusion, the empirical research evidence gathered for this integrative review looked at the effects of chlorhexidine bathing versus soap and water bathing on the prevalence of hospital-acquired infections in the acute care setting. According to the data, chlorhexidine bathing can have a considerable impact on the clinical outcome of this patient population. Furthermore, the findings from Swan et al. 2016 indicate that this treatment is safe, affordable, and simple to use in preventing HAIs in acute care patients who are predicted to require at least 48 hours of ICU care. In relation to the P-code question, for patients in the acute care setting, what is the effect of chlorhexidine bathing compared to soap and water bathing on hospital-acquired infections? The results concluded a significant reduction in hospital-acquired infections in the ICU setting, particularly when gram-positive bacteria were present, without increasing overall mortality rate or adverse events of this patient population. Palato et al. 2019. And I provided some pictures of the type of bathing material and some pathogens.